Okay, so as you'll find out in a moment, we're going to talk about some of what puts you at risk for compassion fatigue. And one of those has its roots in childhood, and a dysfunctional childhood can increase the risk for compassion fatigue. So many of you have heard, I'm sure, of the Adverse Childhood Experiences study that is now being run in the United States with Kaiser Permanente and the Centers for Disease Control and Prevention. And this study looks at a group of over 17,000 patients of Kaiser Permanente and looks at the types of traumas that they experience, whether it be physical, emotional, or sexual abuse, physical or emotional neglect, having a family member who's incarcerated, having a family member with a substance use disorder or mental illness, divorce in the family, and domestic violence in the family. So this is the ACE pyramid, and what the CDC is now looking at is the effect of trauma from conception all the way to death. So the idea is even when a fetus is in the womb, if the mother is experiencing a lot of stress or trauma, whether it be from war, as we're seeing in Ukraine, where pregnant women are having to flee the war there, or many, many other stressors that pregnant women can experience, that does have an impact on the fetus. And they're also looking at historical trauma and intergenerational trauma and how that affects people over multiple generations. And they've added another layer here, which is the social conditions that are also traumatic and can be called adverse community experiences, like poverty, living in dangerous neighborhoods, not having any kind of social mobility or social support, and so on. So these three layers on the bottom really represent childhood experiences that then influence an adult's mental and physical health. And the reason they have that influence is because they change the developing brain. And once the brain has been changed, that can lead to social, emotional, and cognitive impairment. When a person is impaired in this way, they're more likely to adopt high-risk health behaviors such as early promiscuity, drug use, alcohol use, smoking, etc. And then all of that together leads to disease, disability, and social problems. And if they've had enough childhood trauma, it can take as much as 20 years off of their lifespan. So when we are put in a position of caring for others at an early age, we learn to put the needs of others before our own. And we may grow up also lacking personal boundaries. And this can lead to an experience of an overdeveloped sense of responsibility where we carry our unresolved trauma inside of us, but then we go into helping professions because that's what we know. That's what our childhood was like. And if you have unresolved trauma, that can make compassion fatigue more likely to occur. So adverse childhood experiences are, here are the types of things that are considered in the study. I've mentioned, I think, most of those to you. And I've also included an ACE test, the ACE quiz, in your accessory materials, so you can identify your own history of adverse childhood experiences. But if you've had 4 or more ACEs, you are 3 times more likely to have lung disease and adult smoking, 11 times the level of intravenous substance use, 4 times as likely to have early intercourse, 14 times the number of suicide attempts, 4.5 times likely to develop depression, and 2 times likely to have liver disease. So what is so revolutionary about the ACE study is that it really has linked quite clearly, and it has repetitively confirmed that adverse experiences, both from conception up to the age of 18 have a dramatic impact on our health and well-being, both physical and mental health as adults. So whenever there is a trauma or a childhood adversity that's prolonged or repetitive or very severe, the brain undergoes what we call use-dependent changes. And this can then affect the stress system and how the brain of the child responds to stress. And they may then become hyperactive or more sensitive to other stresses in their life. So the brain then resets itself as if it's under threat, even when it's not under threat. There's just this feeling of threat or a sense that a person isn't safe or secure. And that then changes their interactions starting from childhood. I always think about, children who've experienced trauma and how often they end up in the principal's office because they do have this hyperactive stress response. And when they feel threatened, they may act out, for example. So this shows you just the amount. This is the brain architecture here, starting at birth, where the brain has just enough nerve cells to help us survive. So these are cells that have to do with respiration, digestion, breathing, heart rate, etc. By age 6, you can see that there's a tremendous multiplication of these nerve cells. However, by age 14, it's much less than at age 6. Why is that? Because of what I said earlier, that the brain is use dependent. So if you've experienced trauma as a child, your brain is going to constantly be going into that fight, flight, freeze response, and it's likely to go in more frequently than people who haven't experienced trauma. And therefore, the parts of the brain that you use to go into flight or fright or freeze are the ones that get strengthened and built up. But the other parts of the brain get pruned because you're not using them. These may be the decision-making parts. They may be emotional regulation parts of the brain. So the more a child is exposed to traumatic stress, the more nerve cell connections are created in the region of the brain, as I said, having to do with fear, anxiety, impulsiveness, and less in the regions involved with reason, planning, memory, behavior control, and learning. And ongoing stress or trauma can lead to a chronic wear and tear effect on multiple organ systems. And that then leads to long-term behavioral and physiological disorders like depression, substance use disorders, heart disease, diabetes, and stroke. So yes, what I'm saying is that adverse experiences in childhood are correlated with an increased risk for diabetes, heart disease, lung disease, and so on, as well as mental health issues such as depression, anxiety, substance use disorders, etc. So again, here are the risk factors for compassion fatigue. So a history of stressful life events, and 60% of helping professionals have a history of personal trauma. When you look at professionals who are working in the substance use disorder treatment facilities, it's 85% of them who have experienced adverse childhood trauma. A caregiver who doesn't have enough help with caring for a person who is in pain, disabled, or traumatized is at higher risk for compassion fatigue. And then any kind of primary trauma, and that's where we're talking about policemen, firefighters, anyone who's has a job where your life is threatened, where there's a danger to you directly. And then secondary trauma, again, are the people who are hearing the stories of people who've been traumatized. And they may be debriefing a colleague, and the colleague will get secondary traumatization if they're not careful. So if you are sitting in your psychologist's office and you hear this horrible story. And then the first thing you do is go out to the water cooler and tell your colleague about it. That story can be traumatizing to them as well. Also, listening to graphic testimonies in court can do the same. Other risk factors are early career practitioners are at higher risk. Caregivers who feel burned out, but they keep on going. People who have large caseloads and that's overwhelming for them, or they have a history of depression or anxiety or vicarious trauma. Moral distress can be a problem for compassion fatigue, and that is when we are told to do things that we disagree with or we are morally opposed to. And I know this has happened to me, so I'm sure it's happened to many people in the caring professions, where you're told to take on more patients than you can handle, or you're told to send a patient home before you think that before you know that they're ready. Family members who override a do not resuscitate order and do CPR on a patient. Those are all examples of moral distress. Now, there are some specific factors that have to do with the place you work. And I think this is super important, especially if you're a supervisor or an administrator or in the C-suite, to recognize that your employees will be less likely to burn out and have compassion fatigue if they work in an empathetic workplace, if they have adequate training and experience, if they are not hearing these overwhelming traumatic stories in high volume and not having a healthy way to debrief, which is also important. If you're caring for populations such as homeless populations or the serious chronically mentally ill populations, that puts you at higher risk. Insufficient recovery time, poor or no supervision, if you are isolated or if your system is very fragmented, if there are lack of resources in your system. So I want you to take a moment again and list your personal and workplace risk factors for compassion fatigue. So let's go back to some of the risk factors. You can look at some of these here if you want to pause the video or this slide or the workplace risk factors. So take a moment to do that. And when you're ready, come back.